My name is Yosef Mamo. I'm a physician, trained in internal medicine, age 52, and working in Ethiopia. I graduated in 1991, and for the last 25 years I have been working and living in Ethiopia.
My name's Mumford. I live in North Norfolk, where I've lived for the last 25 years. I trained as a nurse in London 40 years ago and have worked in palliative care on and off for most of those 40 years.
There is a rapid rise in chronic diseases like cancer, particularly in women. Breast cancer and cervical cancer are a huge toll, and also diabetes, heart disease. All these chronic diseases are on the rise. And palliative and hospice care happens to be an important service in the package of care for chronic disease. Because of most of these patients with cancer and non-communicable disease in my country, because there is no screening program, they come at advanced stage.
The first thing to say is that there are a lot of similarities between providing palliative care to somebody with a terminal illness in this country and a terminal illness in Addis Ababa. The patients have the same anxieties, the same worries, the same physical symptoms. What is, of course, different is the resources are far more limited in Ethiopia, the setting is very different, and the other very noticeable difference is that the average age of the patients in Addis Ababa is much younger than in the UK. Most of the patients that are seen by Hospice Ethiopia are female patients. And as I've already said, they're much younger than the patients we'd see on average in the UK. So these patients have often got dependent children. And this means that these patients, there's a heavy burden on the family.
The care of chronic diseases is now concentrated in big cities. It is in hospitals and is done by doctors. But the number of hospitals is not enough, and it is far from the rural people where 85% live. And also the number of doctors is not sufficient. It is about 2,400 million people, and that's not enough for all the population. So we have created a model where doctors can work with nurses, taking the service to villages and also to the homes level, particularly in palliative care. Most patients would be served better at home level by community health agents and nurses. So the doctors would be training, supervising, and supporting these nurses, and the nurses would go out into the villages, into the homes to take care of patients. So this model, transportation is an important component of this model.
There are a huge number of areas which we need to pray for. I think top of my list would be praying for the staff of Hospice Ethiopia, for their ongoing commitment and dedication to this vital area of care.
You can pray for patients and families, patients who are suffering from these chronic diseases without much help, and also families who are taking the burden of disease alone.
Another part of my prayers would involve praying for those in authority in Ethiopia to give them wisdom.
To really see this as a good model and really integrate it for the betterment of health of our people.